Gluteus medius tendon tears are a common, but often overlooked cause of lateral hip pain and weakness, especially in middle-aged and older adults. Many patients initially receive conservative treatments like physical therapy or anti-inflammatory medications, but when these fail, surgical repair becomes necessary. Despite surgery, outcomes can be less favorable in chronic or severe tears, leading researchers to explore new ways to improve healing. This sets the stage for our discussion. Can biologic augmentations make a real difference in gluteus medius tendon repair? Let's dive into the evidence and see what current research reveals about these innovative techniques. Biologic augmentations refer to a range of materials and substances used during tendon repair surgeries to enhance healing. These include platelet-rich plasma (PRP), platelet-rich fibrin matrix (PRFM), collagen patches, acellular dermal allografts, synthetic scaffolds, and bone marrow aspirate concentrate (BMAC). The idea is to provide growth factors, cellular support, or structural scaffolding to help the tendon heal more effectively. While these techniques have shown promise in other areas like rotator cuff repairs, their effectiveness in gluteus medius tendon repairs is still under investigation. Understanding these options is key to evaluating their potential benefits and limitations. To assess the impact of biologic augmentations, researchers conducted a systematic review of studies published between 2000 and 2025. They searched major medical databases for clinical outcomes related to gluteus medius tendon repairs using biologic augmentation. Only studies involving human subjects and reporting on pain, function, imaging, or re-tear rates were included. Despite a thorough search, only 4 studies with a total of 123 hips met the criteria. This limited pool highlights just how new and understudied this area is, making it challenging to draw strong conclusions but providing a starting point for understanding current trends. Platelet-rich plasma (PRP) and platelet-rich fibrin matrix (PRFM) are blood-derived products rich in growth factors. While PRP injections have shown benefits for tendinopathy, there's little evidence for their use in surgical tendon repair. One study on PRFM augmentation in gluteus medius repairs found no significant improvement in pain or re-tear rates compared to standard repair. There were slight gains in some quality-of-life scores, but overall, PRFM did not provide a clear clinical advantage. Importantly, no adverse events were reported, suggesting these techniques are safe but may not offer substantial benefits in this context. Collagen patches, often derived from bovine sources, act as scaffolds to support tendon healing. In a small study, patients who received a collagen patch during open gluteus medius repair showed promising early results. MRI scans confirmed healing in most cases, and tendon thickness increased significantly. Functional scores also improved within 6 months. However, this study lacked a control group, so it's unclear if these improvements were due to the patch or the surgery itself. While the results are encouraging, more research with larger groups and longer follow-up is needed to confirm the true benefit of collagen patch augmentation. Cellular dermal allografts are tissue grafts used to reinforce tendon repairs, especially in cases with poor tendon quality. In a study comparing standard repair to repair with dermal allograft augmentation, both groups improved after surgery, but there were no significant differences in pain or function. Interestingly, a higher proportion of patients without augmentation achieved certain activity milestones. No graft-related complications were reported, indicating the procedure is safe. However, since surgeons tended to use allografts in more severe cases, it's hard to know if the grafts truly offer an advantage. More controlled studies are needed to clarify their role. Synthetic scaffolds, such as woven polymer meshes, are sometimes used in challenging cases where standard repair isn't possible. In a small case series, surgeons used a synthetic mesh along with a muscle transfer to reconstruct massive, chronic gluteus medius tears. Patients experienced significant improvements in pain and hip strength, and no major complications were reported. While these results are promising for difficult cases, the evidence is limited to a handful of patients and lacks comparison to other methods. Synthetic scaffolds may be a useful option in select situations, but their long-term safety and effectiveness remain uncertain. Bone marrow aspirate concentrate (BMAC) is another biologic option containing stem cells and growth factors. While BMAC injections have shown promise for treating gluteal tendinopathy without surgery, there's no published evidence supporting its use as an augmentation during surgical tendon repair. This means BMAC remains an experimental option in this setting, and more research is needed before it can be recommended for routine use in gluteus medius repair. As with other biologic strategies, safety appears acceptable, but proven clinical benefits are still lacking. Summary: biologic augmentations in gluteus medius tendon repair are safe and technically feasible, but current evidence does not support their routine use for all patients. Comparative studies have not shown meaningful improvements in pain, function, or healing rates over standard repairs. Some techniques like collagen patches or synthetic scaffolds may offer benefits in select, complex cases, but more high-quality research is needed. As the field evolves, future prospective trials will be crucial to determine which patients, if any, truly benefit from biologic augmentation. For now, careful patient selection and individualized treatment remain the best approach.